NCLEX Prep Coach. I am the founder of Choosing Nursing over at choosingnursing.net, where we help you to pass your NCLEX exam. I'm a registered nurse. I graduated in San Diego State University with my Bachelor's of Science in Nursing degree in May 2010. And I've been a nurse now for 8 years. It will be 8 years officially this month. And I practiced med-surg and telemetry nursing for 4 years, and then 1 year in insurance nursing, and then helping people pass their exam for now about 3 years this upcoming June. And we've had a tremendous success with many repeat test takers to become licensed registered nurses, as well as also practical nurses. So if you're in a position where you are in nursing school, or maybe you have taken the exam, a few times or a couple of times, be encouraged. You're in the right place today. I have tried to provide really valuable information that will help you to successfully pass your exam and then go on to really enjoy and flourish in your nursing career. So if this is your first time watching me, go ahead and follow me right now. I promise you that I give you great information. You can also follow me over on Instagram at choosing_nursing. And then you can also follow me over on YouTube. I'm not on YouTube right now, but you can follow me over on YouTube. And we put out new videos on YouTube every Tuesday. So today we put a new video out today. And then also you can follow me as well on Pinterest. So on Pinterest is also Choosing Nursing. So on all those platforms, you're going to find different information that will help you to succeed in nursing. Also, I usually don't say this all the time, but definitely check out the website, choosingnursing.net, because we've been posting new blog articles on the website. So I really encourage you to check out the website for the blog articles. I've noticed a lot of people have questions that I actually answer through the blog. Like, for example, what review book should I do? Like, how do you study EKGs? Like, a lot of your questions may be addressed if you go to the website and just go through, the blog articles that I've written myself. Tonight I'm going to talk specifically about 5 different types of anemias. All right, 5 different types of anemias. This is actually a very common topic on the exam. Pay attention to what is specific to one over the other. It's really important because you don't want to mix up the information. So let's go with the first one. Let's start with number 1, iron deficiency anemia. This is probably what we say, right, the most common type of anemia. And it's usually going to be more predominant in women. And this is because women have menstrual cycles and heavy bleeding and pregnancy and that kind of stuff. So this is because the person has low hemoglobin levels, right? They have low hemoglobin levels, or they don't take enough iron in their diet. So some people who may be, well, I don't want to say vegetarians, because I'm actually a vegetarian, but I find ways to get iron in my diet. So that's important to ask the patients, what their diet looks like, right? So iron deficiency anemia it's because of they either have a heavy bleeding, pregnancy that can put them more at risk, and so they have low hemoglobin levels. So, and remember, what's the normal hemoglobin? Do you remember? So for women, it's actually lower than it is for men. For men, it's like about 13 to 17, and then for women, it's 12 to 16. All right, so right about around that number. So you got to be aware of, okay, what are the symptoms you would see? Here's the thing about anemia. Anemia most of the time is asymptomatic, unless it's like very low, unless their hemoglobin levels are like, 6 or something. But the first, one of the early signs is going to be what? Fatigue. They're tired, they're pale. Those are some common symptoms. Their tongue may be kind of like inflamed, so kind of like red. They also may have something called colitis. You write these words down, because you got to know the terms, right? That's what people say when they take the test. It's the terms that throw you off, that you never saw before. So they have something called, they may have glossitis, which is where their tongue becomes like inflamed and red. Also colitis, which is like a cracking of the mouth. All right, those are all signs of, but where they're more symptomatic with iron deficiency anemia. So how do we treat this, right? How do we treat iron deficiency anemia? Well, the simple thing, honestly, is to just give them iron. You know, so they need to take iron. Oftentimes, what I'll see is 3 times per day. To me, that's too much, to be honest. but they'll take iron. So here's the thing about iron, right? Because this is now medication. You have to be aware of how should it be given. So iron, this is not B12, all right? This is not B12. I'm gonna get into B12. So with iron, the thing about iron, it can cause the patients to experience constipation. So sometimes you'll see with these patients, we're going to also put them on Colace at the same time, because the iron causes constipation. So they need to take the iron with juice. That's the biggest thing about this drug, is that they gotta take it with orange juice. Do you know why? Right? The number one reason why is because it makes it more potent, meaning that it makes the medication work better, work stronger. So we want to always encourage them to take iron with, for example, you know, orange juice, which is the most ideal. All right, so that's one of the biggest things. Now, in some situations, if their hemoglobin is very low, they may need a blood transfusion. Like, for example, usually when the patients come in, if it's below 8, like as far as the hemoglobin, then we're gonna probably transfuse them. We're gonna give them iron with orange juice. They need to also take more green leafy vegetables. So here's the thing. Here's your nutrition part. So you gotta know foods that are rich in iron, because that's gonna matter when it comes to like food trays. Like, what food tray do you pick out? What type of diet would you recommend the patient eat, right? You have to be familiar with specific types of foods that are rich in iron. So here's some example. Green leafy vegetables, right? That would be an example. Enriched rice, right? Enriched rice, enriched bread, liver, which is disgusting, right? But it's full of iron though, right? So those are some really good examples that you would likely see on the test that contains iron. Fortified cereals, all those are rich in iron content. So you got to know that, you got to be aware of that for the test, right? Okay, so that's iron deficiency anemia. That's the first one. That's the most common one. Now, the next one is pernicious anemia. This is the one, all right? Because remember, iron deficiency anemia is the one where it's low hemoglobin. This is the one though where it's low B12. So you got to make sure that you don't confuse it, because they're all different, you know, clinically and for the test. With pernicious anemia, their problem is that they're not able to absorb, or you know, they're not able to absorb vitamin 12, or maybe not taking enough in their diet. So that's one of the biggest things about pernicious anemia. What's a specific reason why somebody would have pernicious anemia? So what's happened is that they're not able to absorb the vitamin B12, right? And so, or they lost that intrinsic factor, and they lost it because they had a gastrectomy, or because they had a gastric bypass, a gastrectomy. So that's the hallmark thing right there when we're looking at pernicious anemia, especially for the NCLEX exam. Okay, so it's usually, so here's the thing about pernicious anemia, because remember, iron deficiency anemia is more common with like women, you know, adolescents, kids. But pernicious anemia though, it's more common with older adults. So like people who are like 60 and up, it's more common with them. So you want to be aware of that. You know, as far as like the age factor is not the same. So you're looking at older adults, patients that have Crohn's disease, right? Crohn's disease, patients with a history of alcoholism, also another example as well. All right. So let me first break down the differences here. So the first one, with iron deficiency anemia, their problem is going to be typically like, they have heavy menstrual cycles. They're not taking enough iron in their diet, so their hemoglobins are low. But patients who have pernicious anemia, their problem is more so they can't absorb vitamin B12, or they lost the intrinsic factor that would enable them to absorb the B12 because they had a gastrectomy or because they have a gastric bypass. This is also common with patients who are older, also common with patients who have a history of Crohn's disease, and also common with patients with alcoholism. All this is with pernicious anemia, right? So that's what we would, these are the causes that we would see. Now the symptoms though are going to be similar, like all of these symptoms are going to be similar to the symptoms that you would see with just regular iron deficiency anemia, but not the same. All right, so you're going to see with this one, they're going to be confused, they'll be weak. That's very common, like as far as like the weakness. Paresthesia, so this means that they're going to have like numbness and tingling in their hands and their fingers and their feet. And then also that tongue, right? Like I said earlier, they're going to have that swollen, beefy, red tongue, which is also called glossitis. All right, so let me list the symptoms again. They can experience confusion, although it's not as common, but they can experience confusion. That, like I said, that's why it's more common in elderly patients. The next one after that we're going to see is going to be paresthesia in their extremities, weakness as well, and then also that beefy red tongue. So as far as the patients that are vegan, they do have a risk. They do have a potential risk for developing iron deficiency anemia. But if they, like I said, the way that we treat it though is going to be them taking iron and so forth. So it is a risk, but it's not, they're not at the top of the totem pole, so to speak. Okay, so good. So how do we treat this? How do we treat this as far as pernicious anemia? We're going to treat it by giving them vitamin B12, right? They need to get vitamin B12 injections. That's how we treat pernicious anemia.